Hola, buenos días, buenas tardes a todos y todas. Bienvenidos a la conferencia de prensa de la
Good
Organización
morning and welcome to the press briefing of Pan American Health Organization, PAHO. Today is September 21st, 2022. My name is Luciana Villegas, and I am a public affairs advisor. And you can select your language by going into the globe. You will also be able to ask questions through the Q&A button, and we will begin with the questions we have received via email. And thank you to all journalists who send their questions. We begin with words by the director, Dr. Carissa Etienne. And today we have Dr. Ciro Ugarte, director of health emergencies for PAHO, and also we have with us the director of emergent viral diseases.
Let me thank you again for joining today's press briefing. Before I begin, let me express our sadness around the devastation brought on by Hurricane Fiona, and to express our solidarity with the people of the Turks and Caicos, Puerto Rico, and the Dominican Republic. PAHO is ready to support you in returning to normal. So today, I'll be offering updates on COVID-19 and monkeypox in the region. And in addition to discussing polio, which was just confirmed to be circulating in the Americas for the first time in decades. The burden of COVID-19 on our region remains too high. Nearly 1,000 days into the pandemic, we are losing over 4,000 people from COVID-19 across the Americas every week. We cannot accept this as the new normal. Though cases and deaths have been falling, COVID-19 is still among us, and there is no indication that it will go away soon. The risks are significant if we simply let the virus continue to spread freely. Active transmission can lead to new variants, and we should learn from the past and remain prepared to respond to new surges. Even if most COVID-19 cases are mild, this disease can have long-term consequences for patients and for our health systems. If we remain committed, we can keep COVID-19 under control, not by ignoring it, but by continuing to make use of the many tools that we have at our disposal to trace and, most importantly, prevent infections. First, vaccines remain our most essential tool in preventing COVID-19 hospitalizations and death. Countries must continue to make every effort possible to reach those who are unvaccinated, especially among the elderly, pregnant women, and persons with comorbidities or immunodeficiencies. And this is especially true for the Caribbean, where a number of islands continue to lag behind in vaccination coverage. Second, it is important that we continue to track and report both COVID-19 cases and vaccination progress. Member states must update their national dashboards regularly or share this information with PAHO so that we can target our efforts where they are most needed. In the last few weeks, we have seen countries relaxing on vaccination data reporting. And this brings to mind my third point, public health measures. Member states must act wisely and continue to promote these practices in places where many remain unvaccinated or where cases are climbing. Beyond COVID-19, monkeypox cases are still rising in parts of our region. Even if transmission has slowly declined over the past 2 weeks, in the United States, Canada, and Brazil, other countries with large metropolitan populations are seeing an increase in cases. Overall, we have seen an increase of over 23% in confirmed cases in the Americas in this period. PAHO has supported the expansion of testing capacity, and 31 countries and territories are now able to identify and report cases of monkeypox. So far, our region has registered 5 deaths due to this virus. These deaths remain extremely rare, but it is critical to remember that people with weakened immune systems are at risk of complications from monkeypox infection. Of course, countries must act now to control the spread of monkeypox. Active engagement of affected communities, testing and contact tracing can all have a significant impact in reducing transmission, especially while vaccine supplies remain very limited. Lastly, and very seriously, I would like to address a disease that I never expected to see in our region again, and I'm referring to polio. In July of this year, an unvaccinated man was reported paralyzed by polio virus in the United States. In the week since, polio was found in wastewater samples in several counties, including New York. Including New York City, triggering a disaster declaration from the governor of the state of New York. And last week, the virus was indeed found to be circulating through these communities, officially constituting an outbreak in the region. It's been nearly 30 years since the Americas became the first global region to wipe out wild polio, thanks to the comprehensive and coordinated vaccination campaigns. But dwindling vaccination rates worsened by the COVID-19 pandemic have left many of our populations unprotected. Let's be very clear, polio is not a treatable disease. Prevention is the only option, and prevention is only possible with vaccines. As we saw in New York State, polio virus can appear and spread quickly and quietly in communities with insufficient vaccine coverage. And today, polio vaccination coverage is below 80% in nearly all of South America. 12 countries in our region are at high or very high risk of experiencing an outbreak. Now, I don't have to stress sufficiently that this is a serious problem, and one for which we have a clear solution. Immunization with a polio vaccine provides complete protection against polio infection. Let me commend the United States for its swift public health response. Disease surveillance has been intensified. Polio immunization campaigns are targeting those who may not have received a complete vaccination series against polio. And public health measures and messaging is reaching at-risk communities in their own languages. PAHO is in close contact with the United States, and we have issued several alerts to member states so that they remain vigilant. I really cannot state this strongly enough. We urge all countries in the region to strengthen surveillance and proactively reach the unvaccinated with polio vaccine. PAHO has already alerted all heads of states of the region with regards to the risk and the threat and the need to catch up on polio immunization as a matter of urgency. We must not take the life-saving power of vaccines for granted. On another note, next week, I will have the honor of joining ministers of health from across the region at the 30th Pan American Sanitary Conference, a landmark event that brings together the health leadership of our entire region every 5 years. This is an opportunity to look back and learn from the challenges that the Americas have faced over the past few years. But more importantly, it is an opportunity to look towards the future and our vision of a more equitable region in which we work together to improve health for all. Thank you.
Thank you very much, Director. We will start with a follow-up question on the polio situation in the region that we have received from several media. We go with a question from Bernardo Almeida from Agência Minas in Brazil. Bernardo says he's doing a story about the risk of polio in the continent after decades of eradication. Recently, PAHO issued a warning that Brazil would have a high risk of the reintroduction of polio, along with few other countries in the Americas. He would like to know which other countries are in the same situation and why is this the case? Dr. Tien, please.
Let me thank you for this question because it means that the media is aware of the polio threat. So let me say thanks to the tireless efforts supported by PAHO, the region of the Americas was the first to eliminate polio 3 decades ago. But the low levels of vaccination that we're seeing across the region are giving this forgotten disease an opportunity to rear its ugly head again. And I know that many of you have never seen a case of polio. But let me say that polio crippled generations before vaccines were developed, sentencing thousands of children to a lifelong of pain and disability. We do not want a return to this scenario, especially when we have the means to stop it. An infant who receives all polio vaccine doses according to his or her country's national schedule is protected for life, and high levels of vaccination prevent the reintroduction of the disease. Now, polio vaccination coverage in the region is about 79%. This is the lowest it has been since 1994. And this is a very serious situation. And based on the assessment of vaccination coverage and surveillance and other indicators, the Regional Certification Commission for Polio Endgame in the region of the Americas in July listed Brazil, the Dominican Republic, Haiti, and Peru as very high risk for the reintroduction of polio, and named Argentina, the Bahamas, Bolivia, Ecuador, Guatemala, Panama, Suriname, and Venezuela as high risk. The good news in this is that polio is a disease that we can do something about in a relatively short period of time. So I am aware that COVID-19 posed an enormous challenge to countries and to their health systems, disrupting services and diverting resources to fight the pandemic. Also, hesitancy against vaccine has also grown, fueled by misinformation. But we must pick up the pace to correct this course. As I said, I've written to leaders in the region, urging them to take rapid measures to strengthen national vaccination programs, including actions to increase the public trust. I have also taken administrative steps within PAHO to ensure that we are able to provide swift assistance to countries that need it. Through sustained high vaccine coverage and robust surveillance, the Americas remained polio-free for over 30 years. And look, we've done it before. We know what we need to do. And I dare say we can and must do this again. Thank you.
Thank you very much, Dr. Tien, for answering this question. A los periodistas pasamos a las otras preguntas que recibimos con antelación.
Now we go over to the other questions we have received, and in the chat now we start with questions from Mexico. We have from Dinara Perez from different outlets, and Blanca Valadez from Grupo Milenio and others. And we have a question from Blanca. The first one, Latin America, in particular, Mexico, is ready to declare the end of the pandemic. We knew the virus will continue to circulate. Dr. Ugarte, over to you. Thank you very much, Luciana. Thank you, Blanca, for your question. It is very relevant indeed. Colloquially, we've used the word pandemic, and we use it very often to describe an event. However, this description or characterization is just an approach to describe so that the population has a more or less homogeneous understanding of the risks represented by a disease that is attacking and affecting many countries at once. The WHO does not officially declare pandemics except in the case of influenza. And given that there is no mechanism to declare pandemics, legal instruments that exist, this term has no recognition whatsoever in terms of international law. However, the WHO does determine whether there is a public health emergency of international concern. This is the highest level by WHO when there is a public health emergency. And this alarm is sounded when an event fulfills certain criteria. And so the Director General of WHO declared COVID-19 as this event in January, and then in March, and having a clearer idea of the virus, the Director General of WHO again characterized COVID-19 as a pandemic. In other words, he reported that more active measures should be taken in that sense. And from that date onward, the Emergency Committee of the IHR is the mechanism through which WHO analyzes risks, meets every 3 months as required by the IHR, the International Health Regulations, to analyze the situation and to analyze whether the criteria for a public health emergency of international concern continue to be met. And the next meeting will be in October. And so in October, this emergency committee will determine whether COVID-19 continues to be an international concern, international emergency. And if that's the case, they will issue certain measures, or they will recommend to the Director General that it no longer deserves to be considered an international emergency of concern. So the virus, however, will continue to be with us. So it is up to us to reduce the risk of transmission amongst us. Thank you very much. Thank you, Dr. Ugarte. Second question by Blanca Valadez. She wants the opinion of PAHO about the report on the Lancet Commission on COVID-19, stating that global failures generalized in nature in responding to the disease led to millions of avoidable deaths and reversed progress toward meeting the SDGs. Thank you, Blanca. With respect to this question, WHO has officially responded to the Lancet Commission on COVID-19. And let me emphasize a few points. Yes, what you said regarding the impact on the lives of millions of people who could have been prevented, and the reverting of the progress toward the SDGs are clear. However, the Commission also points out several items in this context. We all need to be better prepared and to be able to better respond to new emergencies. And the Commission supports the work of WHO, and it recommends that it should be strengthened and that the reforms should include a sizable amount of budget going to that. The countries gathered together approved sustainable financing so that WHO can continue to cooperate with the countries. And the Commission also includes other important facts in their report. For example, the lack of funding for all preparedness and response teams at the UN level, at WHO, and the global structure for responding to emergencies. So in many cases, the Commission also emphasizes that the excessively nationalistic vision, more looking inward and internal benefits of each country, may have also contributed to inequity in many senses, including vaccine inequity. To conclude, then, it is necessary that a proper assessment be done on what we did well collectively, and those things where we need to improve collectively as well be done in a transparent manner with all the stakeholders who actively participated in response to the pandemic. And in that analysis, we will be able to in doing that analysis, we will be able to understand what should be done immediately to protect the lives of the population and the safety of the population. The Lancet Commission's report mentions, and we have mentioned it too, that it is a shared responsibility, including international agencies and international and national governments all over the world. Thank you. Thank you, Dr. Ogante. A question from Matias Levy from Medscape in Spanish, from Argentina. In the United States, there are states where the vaccination rate against COVID in children under 5 is under 1%. Do you have information of how vaccination is doing in this age group in Latin America? And is there any reflection by PAHO on the need and importance to immunize children under 5? Thank you. Thank you for this question, Matias. Data about vaccination reports in children are available. So we do have that information, and the data indicate that 38 of those countries and territories in the Americas are offering vaccination in children 5 and over, and 11 children 5 and under. And 4 offers vaccination to babies or infants 6 months and older in the United States, Puerto Rico, and Argentina. The recommendation of both Pfizer and Moderna vaccines broaden eligibility to all people 6 months of age and older. PAHO continues to recommend that people with the highest risk of infection, hospitalization, and death due to COVID-19 should receive all the doses of the vaccine as soon as possible. This category, of course, includes children and adolescents under 18 with comorbidities who will have increased risks for hospitalization and death. We still see that children have lower vaccination coverages, but at the same time, they have fewer symptoms and less serious disease and death due to COVID-19. So we're following this process very closely with the countries, and we have developed a guideline for dialogue about COVID-19 vaccination. This guide has been published on our webpage, and all countries have access to this webpage with that information. Thank you. Thank you, Dr. Ugarte. Now we have a question from Julia Bonilla from La Razón, Mexico. Mexican authorities have announced that they will withdraw the mandatory nature of several measures of prevention of transmission and working areas and also businesses. For example, the use of antibacterial gels, physical barriers, filters to go in, like taking temperature, etc. What does PAHO think of this? Thank you, Julia. This is a very relevant question. Every time that public health measures are lifted or made flexible, this leads to an increase in the number of cases. When transmission is very high, this leads to more hospitalizations and more deaths. The number of hospitalizations and deaths are low now because these and other measures have been implemented. So the organization continues to maintain preventive public health measures to reduce risk whenever it is necessary. But each country is free to make those decisions, and also each municipality and each state or sub-regional area, and assessing health services, levels of transmission, and the risk of or if there are low vaccination rates, then this should lead to maybe changing things. In Mexico, we are expecting to have an increase in the number of cases at the end of the year in festivities such as Dia de los Muertos, the Day of the Death. So it is good to be assessing constantly the situation. It is a responsibility of all of us to reduce the risk, not only of COVID-19, but also influenza and other respiratory infections that can affect people in different countries.
This is a question again about monkeypox, and this is a question related to the situation of monkeypox and where and how the situation is doing in connection with the number of transmissions and whether new measures should be implemented given the advance made by new confirmed cases. Dr. Rico. Thank you very much, Julia, for very important questions. First, I would like to underscore that, as we all know, monkeypox is new to the region of the Americas. Therefore, all of the surveillance systems with the ministries of health had to adapt to include this new event. Mexico has a solid surveillance system and a solid lab network that has a rapid capacity for addressing the situation. Today, with 1,367 cases confirmed, Mexico is the third country in the region as to the number of cases. As to control measures, PAHO has offered technical assistance to control the transmission of cases, and it is important to bear in mind that it is not just one measure, but a set of measures that may work. One of those measures includes maintaining, for example, mechanisms for coordination with different sectors to have efficient systems addressing stigmatization and also based on population groups. It is also important to strengthen surveillance systems, clearly including a strong laboratory network, which is key for anyone that needs diagnosis that allows for fast diagnostics and detection. It is also important to facilitate timely access to medical care, clinical care to those patients who are affected, and also their contacts. And right now, it is important also to strengthen communication and risk communication in a strategic fashion to focus on prevention and also prevention measures to diminish the risk of transmission and contagion. Thank you very much for the question. Thank you, Dr. Mendez Rico. We have another question by Helena Pinedo, scientific journalist with the Peruvian Ojo Público. She's asking, how much has PAHO invested to purchase monkeypox vaccines, and what type of biologicals are being purchased? Is it second or third generation biologicals? Dr. Ugarte. Thank you, Luciana and Gilena. The countries of the Americas agreed to buy supplies through the revolving fund to address monkeypox and to ensure best prices and quality for the countries. PAHO is purchasing third-generation vaccines, and we estimate that the first deliveries will take place over the next couple of days. Thank you very much. I thank you, Dr. Ugarte. We have a question by Daniel Coyin from TN23 Guatemala. He's asking, is Guatemala one of the countries that will be receiving PAHO support in connection with monkeypox? And so when will this be provided? Thank you very much for your question, Daniel. PAHO on August 5th had a special meeting of the Directing Council, and the member states requested PAHO to provide vaccines through the revolving fund. So far, 13 countries in the region have requested the purchase of these vaccines through the system, and other 7 have expressed their interest in acquiring the vaccine by means of the fund. Guatemala has also expressed their interest in buying through the revolving fund, but they're still reviewing the internal mechanisms within the country and also the requirements by the manufacturer to sign the agreements. Once that stage is addressed, we will determine a timeline for the purchase and delivery. It is also important to mention that for all of the countries in the region, in particular for those who will be receiving the vaccine purchased through the revolving fund, PAHO, together with the advisory groups for the Americas, has also developed the technical operational guidelines as to the use of the vaccines against monkeypox that will be available in the upcoming days for all of the countries that would be interested. Thank you very much. Thank you, Dr. Mendez. Rico, we have a question, a follow-up question by Lorena Sanchez Cabrera, a journalist from Mexico, who is saying that even though PAHO has already recognized that transmission is mainly among men having sex with other men, why is it that there is no preventative campaign addressing this sector? And she's also asking whether monkeypox could become a sexually transmitted disease. Dr. Mendez Rico. I thank you for the question. As a matter of fact, we are working together with the communities to deliver messages and effective communication targeting various groups, in particular the groups that have been highly affected. This is something that has been done together with WHO and other associations so as to establish better communication paths, and we are clearly focusing our work so that it is more targeted, and I think that we have gained ground as to whether it is possible for this to become a sexually transmitted disease. We are carrying a great deal of studies since indeed, because of the conditions that we currently see, it is clear that the transmission mechanism has to do with close contact, intimate contact, and this has also led to all of these cases. As to sexual transmission, that is to say, given sexual relations, we are still carrying out studies to determine the presence of the virus in fluids and in semen, and we are trying to determine whether the virus is viable and still alive in these fluids, body fluids that could actually allow for transmission, but currently there are no studies or results to confirm or to evidence that this is a path of transmission. I hope I have addressed the question. Thank you. Thank you. We have a final question on the vaccines. COVID vaccines by Gabriela Solorzano from Channel 12 in Nicaragua. She's asking whether we already have a date for the next batch of Pfizer vaccines for children that will be delivered in Nicaragua? And how do you position Nicaragua in terms of vaccine coverage? Dr. Ugarte, thank you, Luciana. Thank you, Gabriela. We estimate that the delivery of the next batch will be in December. We are coordinating with the Nicaraguan authorities, and we also recommend contacting the government to obtain information on the details or further details. As to the second question, as to where we or how we position Nicaragua in terms of vaccine coverage, let me tell you that Nicaragua has reported high vaccine coverage against COVID-19, and PAHO has been supporting the development of a vaccination system that is now expanded to the vaccines from the ordinary schedule. So I would like to underscore that COVID-19 vaccination is a priority, a national priority in Nicaragua and in several other countries. And to that end, I would also like to take advantage of this question to underscore the role of the vaccine administrators who reach the most remote areas within the countries. Those teams of vaccinators sometimes ride horses, they ride bikes, vessels, any means of transportation. And this is not something new. This has always been this way, but given sometimes difficult situations, they arrive to provide the vaccine that people need, that children need, as well as pregnant women and people who require them in the most remote areas. So I would like to call the attention of everyone who is connected here today to especially recognize those individuals and also the national immunization programs, in particular those that need to do it in different languages different from the official languages of the countries, and they have to speak the languages of the communities, for example, Mosquito and Creole in the case of Nicaragua. So as part of that process, this is one of the reasons why COVID-19 vaccination has increased enough in those communities, and those communities that have no easy access to health services, the vaccine has literally saved lives. Thank you. Thank you very much, Dr. Ugarte. We have questions, follow-up questions on the polio situation by Gisela Salomon, for example, from Associated Press, and Jensen Lamende from Newsday. They're asking whether cases have been detected in Latin America, how many, where, in what countries, and Jensen is also asking about Latin America and the Caribbean. Dr. Ugarte, do you have any information regarding this? First, there are no confirmed polio cases in the Americas and in the Caribbean. There is a surveillance system for acute flaccid paralysis that is the one used to detect suspected cases, and that mechanism is active in all of the countries. Given the comments by the remarks of our director, and also given the guidelines that she has shared with our organization, and also as a recommendation to the countries, surveillance is being increased to detect promptly any cases of acute flaccid paralysis that may be related to polio, and also mid-risk and high risk in our area. It includes Argentina, Brazil, Ecuador, Guatemala, Haiti, Panama, Peru, Suriname, and Venezuela. And the list would go on and on if we look beyond coverage. So this is a highly significant topic for the Americas. We need to strengthen that, given the decrease in coverage, the risk of new cases is at the highest point of the last 25 years. So it is highly significant for that process to increase. And in the case of our region, we also need some more specific support, and we are working with them, with those countries. We thank you, Dr. Ogarten. Now unfortunately, we're reaching the end of our session today because of the spokesperson's agenda. We have to conclude, but before that, I would like to give the floor to Dr. Etienne for her final remarks about the upcoming week.
Thank you, Luciana. So, as I mentioned earlier, the Pan American Sanitary Conference will take place next week. And I would like to invite each of you to follow the conference, which will be streamed online. The conference is an opportunity for health ministers from across the Americas to share new information and to coordinate efforts to address current challenges like COVID-19, monkeypox, and now polio. The discussions during the conference will go beyond the present. Importantly, together, we will define the priorities with the potential to transform the health of our region. And these include how we better care for and protect mental health, increasing genomic surveillance to track and respond to diseases like COVID-19, the strengthening of regulatory and manufacturing capacity to improve our regional self-reliance and also resilience for future threats. The last 5 years have greatly changed our health landscape, bringing both significant achievements, but also unexpected setbacks. Next week, PAHO will be releasing its quinquennial report, which is an in-depth look at the progress that we have made and the challenges that we have encountered and continue to face. I invite you to read this report. This year's Pan American Sanitary Conference falls in a very important year for PAHO for two reasons. First, 2022 marks the 120th anniversary of our Pan American Health Organization, 120 years of working together to build a healthier and more equitable region in solidarity. Second, my tenure as PAHO director comes to a close in January 2023. And so ministers of health will also be voting to elect my successor, who will oversee our mission for the next few years. This transparent and democratic process is a core part of our organization and strengthens PAHO position as an ally to all countries in the Americas. So I do hope that you will join us and listen to the Pan American Sanitary Conference next week. And may I also take this opportunity to thank you for being at this press briefing, and we hope that we will see you soon.
Thank you very much, Dr. Tien, the director, for the final remarks. A los periodistas, los colegas, llegamos al final de
To the journalists and colleagues, we have reached the end of this session, and soon enough we will be sending the notice on the sanitary conference, and we will also share the links over the chat to join us for that conference. We will have the next press briefing over the next 2 to 3 weeks, and we will be emailing you, and we are clearly available for any follow-up questions that you may have. We have some questions that were left in the Q&A, and we will be addressing those questions in writing, and you can send other questions to media team at PAHO.org. Once again, I thank you for the participation. Thank you for connecting, and see you over the next couple of weeks. Thank you.